Baggy eyes and eyelids. Many people have them, but what looks like normal under-eye bags could actually be a condition known as festoons. Festoons occur when the skin of the lower eyelid is damaged, usually by the sun. Luckily, there is a treatment available to correct that problem. Here's Dr. Randy Schuck with more.
Joining me now is Dr. Adam Scheiner. He is an ocular plastic surgeon or a facial surgeon, and we're going to talk about some things that all of us have. We're talking about those little bags underneath our eyes, the problems that we have as we get older and as we sleep a little less. We have more and more of these problems. So first, thanks all so much for joining us today, and tell us a little bit about the background of why we get these eyelid bags.
Yeah, well, first I want to say thank you so much for having me. And there's two reasons that we have eyelid bags. And to pull back a little bit, we're very nonverbal beings, and we love connecting with each other. And we evaluate faces all the time. When we have heaviness in the lower eyelid area, it makes us look tired or sick, and we don't want to come across that way. And so the first issue is really the eyelid bags. They form below the lower eyelids. They're kind of puffiness here. That's mainly genetic. There are some age-related causes too, where the tissue gets lax and the fat pads push forward. But then there's this thing called festoons. They form more on the cheek region. They're swollen mounds that form on the cheek. And they've been traditionally kind of a challenging condition to treat.
So when we talk about these, first the eyelid bags, anything to do with sleep? Does it matter if I sleep or not? You say it's genetic, but it seems like as I don't sleep, and I don't sleep as much, that they get a little worse.
That's correct, and that's why people, when they see them, our subconscious brain tells us that someone's tired when they see that. Interestingly, there's fat pads that come forward, so yes, in the morning there's more fluids that distribute. They can be a little worse in the morning, but otherwise they're not really caused by lack of sleep.
All right, so as we get older, obviously our face actually gets thinner too, right? So we start seeing the sunken eye pieces and the relationship between that?
Yeah, and there's some volume changes that happen in the face as well, in the cheek region, that makes that more visible. But really it's a relaxation of the something called the orbital septum, this structure that holds the fat back around the eye. It kind of shifts forward, and that's why we see this. Okay,
so there's a lot of stuff over the counter. All these cosmetic companies, everybody else tells me that if I put this stuff underneath my eyes, it's going to make the bags go away. True or not?
Yeah, temporarily you might get some improvement in some of the wrinkles in the skin, but really for the fullness there, nothing will cause any permanent change there.
Okay, so you actually work laser-wise, so tell us about the procedure. Tell us the difference between what we've done in the past and what we're doing now.
Right, and so for eyelid bags, people have done things with fat where they've moved it or taken it out. That's one thing. The festoons, it's been really difficult. People have tried to make cuts on the cheek region, and that leaves scars. People don't like that. I use lasers actually as a way to improve the quality of the skin. The laser can actually tighten the festoon from the outside in.
So on those, when the lasers actually, is it going under the skin, or is it actually making the skin itself a little bit more tighter?
Yeah, it works on the outside, and it tightens the skin from the outside in.
So similar to what you would call the old facelift, where they pull the skin up or pull it out only without having to cut.
Correct, no cutting, right.
All right, so if this is a genetic issue and if this is actually made worse by sun damage, what are some of the things we can do to decrease the chances of us having this?
Right, I think that really the sun is really the genesis for most of these festoons, and wearing sunblock on a daily basis really is very helpful. There's something known as incidental exposure. We don't think about going to the mailbox or walking down the street, on a normal day as getting sun exposure, but those little bits add up all the time, so wearing sunblock daily is really important.
All right, the argument always is with sunblock, how much is enough and how often do I have to put it on?
Right, and what I like best are the mechanical sunblocks, the titanium oxide and zinc oxide. Those are actually the best ones as they work immediately. And they'll last for hours, but every 3 or 4 hours it's good to reapply.
Now those ones you're talking about, those are the ones that look like I'm wearing a little war paint underneath, correct?
Correct, but they actually have it micronized now, so it actually blends into the skin beautifully.
All right, so I won't look like the guy in the football game anymore. What about hats or anything else? Would it be helpful?
Yeah, hats and glasses also are very, very helpful. Any way that we can shade our face and keep the sun off of that really makes a big difference, and that helps with sun damage in general and the festoons specifically.
Sure, now is it just outside, or can it also be through the window, driving a car, or those things have an accumulation issue as well?
Yeah, interestingly, UVA rays, which come down from the sun, is a very long wavelength. They can actually penetrate clouds and car windows. So yes, UVA, you can get sun exposure inside your car too.
All right, so obviously you want to make sure your sunscreen has both UVA and UVB, and you can see that on the back. And you say that the physical block ones, titanium one bases are a little bit better.
Correct.
And hats obviously would work well. So this laser obviously is not just used for the Festoons themselves. Give us a couple other things that you're using it for.
Right, I found it fascinating. A couple of years ago, I found that I was able to remove sun damage with this. So I was able to get underneath sun lesions and remove these sun lesions. So there was a cosmetic benefit. There was tighter skin, there was less wrinkles, but then also I found that people had much less skin lesions coming up after the procedure. So now I've actually adapted this procedure for this. I'm calling it the reset for sun damage. I'll actually get into the skin, go under certain layers. I see the sun lesions, I'll take them off, and the skin then grows back as a healthier structure afterwards.
All right, and does that, obviously it will decrease the chances of having sun damage, but what's the decrease in going into sun cancer or skin cancer?
Right, we have a lot of things called actinic keratoses, which are these flaky lesions that form on the skin. 10% of those go on to form squamous cell carcinomas in the future. When I do this procedure, I wipe all of those away. And so that dramatically reduces the chance for cancers in the future.
And the actinic keratosis on the face, obviously. Can you do it everywhere on the body, or are you only doing it on the face currently?
Because wound healing is part of this procedure, the face actually heals much better than other parts of the body. There's some reasons for that, but really it's better just to do this on the face.
All right. Now, actually, doing a little bit of reading about you, there's some before and after pictures that we can show later on. But you do a lot of people coming in through the United States. It's a lot for the Tampa Bay area. Tell us a little bit about the average person coming into your office.
Yeah, I mean, I'm fortunate. I live here in Tampa, and I'm a resource really from around the world. So 80% of my practice is people flying in to see me for my services. And I love the fact that they can come here, stay in the hotels, use the restaurants, go to the activities while they're here. And I'm a little engine for Tampa this way.
Yeah, that's great. Now, obviously, Florida being a perfect place for you because we have a little bit of sun. We have a lot of sun damage. So the average person coming to see you, what do you recommend they do before they actually see you? Anything special, or do you, basically you can treat pretty much anything?
I mean, honestly, I tell them to protect themselves from the sun anyway, but I can treat it after the sun damage is there. I can reverse it.
Excellent. All right. Well, great information. Obviously, a lot of people have a lot of problems with this sun damage picture, especially for us that have our face taken a lot of time. So thank you so much for the information. Thank you so much for joining us today, and certainly keep up the good laser work.
Oh, thank you so much.